The transverse abdominis attaches from the lateral 2/3 of the inguinal ligament, the anterior 2/3 of the iliac crest, the thoracolumbar fascia, and then it's going to wrap around and connect to the lower 6 costal cartilages, so ribs 7 to 12. It's also going to have an attachment to the xiphoid process. Hey everyone, Steven here with TV Fork, and this week's YouTube shorts are dedicated to the transverse abdominis muscle. The transverse abdominis is one of your abdominal muscles. It's the deepest of your abdominal muscles, and one of its responsibilities is going to be spinal stabilization, which makes it a very important muscle, especially in managing something like low back pain. It's often going to be very, very weak in a lot of people, so what you would want to do is perform some strengthening exercises for the transverse abdominis. For the transverse abdominis, there are only 2 areas that we need to be covering, and that is going to be the pelvis and the rib cage. At the pelvis, this right over here is your ilium, and then at the side of the ilium we have the iliac crest, and at the most inferior aspect of the pelvis, straight down the middle, right over here is your pubic symphysis. But those are the only important landmarks worth noting at the pelvis, and now we're going to move up to the rib cage. At the rib cage, this right over here is your breastbone. At the most superior aspect, we have the manubrium. In the middle, we have the sternum, and then at the most inferior aspect, we have the xiphoid process. And then just lateral to that, we have the costal cartilages, and that is what connects the ribs to the breastbone. But for this part right over here, the only important costal cartilages worth noting are that of ribs 7, 8, 9, and 10. But those are the only important bony landmarks when discussing the transverse abdominis. The transverse abdominis attaches from the lateral 2/3 of the inguinal ligament, the anterior 2/3 of the iliac crest, the thoracolumbar fascia, and then it's going to wrap around and connect to the lower 6 costal cartilages, so ribs 7 to 12. It's also going to have an attachment to the xiphoid process, the linea alba, and it's going to have an indirect attachment to the pubic symphysis via the rectus sheath. And because its fibers run horizontally, its main action is going to be compression of the abdominal pelvic cavity. So you could think of it as your body's natural corset system where it tightens everything up and tightens up the core. But that is the main action for the transverse abdominis muscle. The transverse abdominis is innervated by the intercostal nerves, and more specifically the ventral rami of your T7, T8, T9, T10, T11, T12, and L1 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the transverse abdominis to fire properly, and that can lead to limited blood flow and oxygen in the area, which can lead to a lot of low back pain. So what we can do to address that would be to do some ELDOA exercises. The reason the ELDOAs are going to be so great is because the whole purpose of an ELDOA is to create space within a joint. So if we're able to create space within the joint, we can improve the function of the nerve roots, and then the nerves are going to be able to send the proper signal to the transverse abdominis to fire properly, and that can improve blood flow and oxygen in the area and mitigate low back pain. Today I'm going to be taking you through a strengthening exercise for the transverse abdominis muscle. And for it, we're going to be in a supine position, meaning you're going to be laying down on your back. You want to go ahead and flex the knees to 90 degrees, plant your feet firmly on the floor. We got retroversion of pelvis, flat lumbar, flat thoracic, chin tucked in, crown head away, eyes lifted down between thighs to the derm matter retention. Principle of action, we want to take a big, deep breath in, and then on the exhale, we want to drive the belly button down toward the spine. Once we can no longer go any further, we're going to inhale, keep that belly tucked in, and then we're going to exhale, drive the belly even further down into the spine. We're going to inhale, keep it tucked in, exhale, drive it further down into the spine. Inhale, keep it tucked in. Exhale, drive it down further into the spine. One more time. We're going to inhale, drive the belly down, keep that tucked in, and then exhale, drive it down further into the spine. Then we're going to inhale and take a regular breath. And we're going to repeat that 3 times. For the transverse abdominis stretch, we're going to get into a supine position, meaning you're going to be laying down on your back. You want to flex your knees to 90 degrees, plant your feet firmly on the floor. We want to maintain retroversion of the pelvis, flat lumbar, flat thoracic, chin tucked in, crown head away, eyes looking down between our thighs to put the derm matter under tension with the arms, place them at the glenohumeral angle, and then for the principle of action, all we want to do is drive the belly button as close to the ceiling as we can. So we want to expand the belly and make it as big as possible. But this is the myofascial stretching exercise for the transverse abdominis muscle. For the T7, T8 ELDOA, we're going to be in a seated position, and we want the feet together. We're going to flex the knees as much as we can until the lumbar spine starts to round. As soon as the lumbar spine starts to round, we're going to stop right there. We want to create a lemniscate in the lower extremity to create maximum myofascial tension in the lower extremity. We're going to do that by raising the big toe up, flattening the medial arch, going to lateral rotation of tibia, medial rotation of femur, retroversion of pelvis, flat lumbar, flat thoracic, chin tucked in, crown head up, eyes looking down at the floor to put the derm matter tension. With the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex the shoulders to level coron plane, so biceps in line with the ear. Then we're going to lower the arms to the level of the glenohumeral angle. If you don't know where that is, depending on everybody's morphology, it's going to be anywhere from 90 to 135 degrees. For the average person, when your arms are fully extended and the palms at the level of your forehead are slightly higher, that's going to be your glenohumeral angle. We're pressing away with the palms, up with the crown of the head, keeping those knees tucked in, and this is the T7, T8 ELDOA.